Hi, my name is Carol. I'm a nurse at Enloe Women's Services, and I'm going to be providing you with some information for the next 30 to 40 minutes regarding what's going to happen during the next few months, both at the office and in the hospital. This class is called the Pregnancy Preview class. So when you go to your first appointment, if they ask you if you attended the Pregnancy Preview class, you can say, yes, you did. I'm going to be doing this recording, so hopefully you can just kind of listen and take your time. It's a lot of information, and I don't expect you to remember all of it, but it is important information that we would like you to know as we welcome you to the Enloe Women's Services family. We're going to start off just congratulating you and letting you know that this is called the Pregnancy Preview class, so you're going to want to make sure you tell them that you attended. Thank you for listening today. I like to start with this slide just because it talks about the Mother and Baby Care Center, and I just want you to know that's what labor and delivery is called at Enloe. So if you ever hear anybody refer to it as the Mother Baby Care Center, that is labor and delivery. So I like to make sure you're aware of that. The first and most important thing that you need to know is where you're going to be going for your first appointment. So if you are seeing Dr. Wenberg or Dr. Green or the midwives, you'll be attending their office at 1665 Esplanade, and it's right across the street from Nash's Restaurant on the same side of the street. If you're going to be seeing Dr. Valkaringi, you're going to go to 1405 Magnolia. We call that the South Office, and that's right across the street from the entrance to the emergency room. If you're seeing Drs. Chun or Dr. Burke, then you'll go to 1423 Magnolia, which we refer to as the North Office. Just so you know, in the future, if you ever need any assistance with breastfeeding or baby education, we do have a supply store that's at the Fountain Building on Cohasset. However, at this time it is closed, but hopefully it'll be opening soon for people's needs. The Nettleton Mother Baby Care Center is what I told you about on the last slide. That's the name of labor and delivery. The Sweet Success program is for patients that have diabetes either before or during pregnancy, and you'll find that out towards the middle of your pregnancy. And if you do find out that you have gestational diabetes, then we will connect you with the proper resources. And then the last thing on this slide is the perinatal and postpartum support group, which I'm going to go over a little bit later in a couple other slides. An important part of this presentation is that you know about the Enloe website. If you visit www.enloe.org/baby, there's a lot of really good information on this website, and I'm actually going to go to that website right now during this presentation. I'm just going to switch over here. If you go to this website, this is what's going to pop up, and it's actually the Mother Baby Care Center website, and you're going to be able to look up all sorts of information and resources. If you look on the left-hand side here, you can see the titles of the different links, everything from preparing for pregnancy all the way through labor and delivery. There's also classes listed here, which at this time, which is May 21st today, there are no classes being taught in person, but hopefully in the next few weeks we will be changing that. So you would have access to classes you might want to sign up for, and you can look them up on this website. There's also a pregnancy health library here. We like to encourage you not to Google information when you're pregnant, although we know that everybody does. But if you want some really sound evidence-based information, I recommend you go to the Pregnancy Health Library on this website, and you can look up anything you want to know. There's also information on breastfeeding services, labor and delivery, and Meet Your Care Team. If you want to know what your doctor looks like or read a little biography about them, you can actually go to this link right here where it says Meet Your Care Team. The other thing on here is if you search in this area right here for the pregnancy planner, that's the booklet that we're going to be going over today. And you can actually download a PDF to your phone or your computer, and you can peek at it before your first appointment. You will be given this booklet at your first appointment, but if you want to see it before then, you can search for pregnancy planner here in this bar. So I'm going to go back to my other page. And hopefully you can see the screen here again that talks about our the Enloe website. Also on that website, you can search for the Going Home booklet, and that's another booklet that you'll be given after you have the baby from in the hospital. And you can download that as well if you'd like to start looking through that information. Another very important part of the website is you can sign up for MyChart. If you haven't already done so, we highly recommend that you sign up for MyChart. It's an online portal where you'll be able to access your lab values, your ultrasound reports, and most importantly, you can communicate with your providers through this MyChart app. If you have any questions during your pregnancy at all, you can send us a question over the MyChart app, and we will respond to you usually within a couple hours. If it's an evening time or weekend, remember that we won't be in the office to see those messages, but as soon as we're back in the office, we will look at them and we'll get back to you in a timely manner. If it's a question that a nurse can answer, we will answer it for you. If it needs if you need doctor's advice or if you're trying to get a hold of the doctor, then we'll pass the message on to your provider. And then also on that website, there's an electronic tour of the Mother Baby Care Center. So you can click on either the English or the Spanish version, and you're able to actually see the labor and delivery unit and get to know it before you get there. This is what the pregnancy planner is going to look like, the booklet that you're actually going to get in your first visit. And like I said, it's full of a lot of information. We're going to go over some of the highlights of it today, but I want you to make sure that you just kind of keep it near you when you're home, keep it by the couch or by your favorite chair, and just look at it when you have an opportunity to, so that you can kind of get to know the information in it. It covers everything, so you might not want to look at it all in one day, but you might want to, and just keep it handy so you can refer to it often. One of the first things we talk about in the booklet is the pregnancy health and lifestyle aspect. How many times are you going to be seeing the doctor during your pregnancy? Well, it's going to be frequently. With your first visit, you're going to see the doctor usually around 8 to 10 weeks of pregnancy. And then until you're 28 weeks pregnant, you'll go every month. After 28 weeks, you go every 2 weeks. And then from 36 weeks on, you'll be seen weekly. At this time, some of our visits are done by telemed, but you would know in advance if that's how your appointment was going to be held. Antepartum testing is something that happens usually the third trimester of pregnancy, and it's for high-risk pregnancies. So if you have gestational diabetes or high blood pressure, you might come to the antepartum testing area, which is where I work, and we would do non-stress tests on you at that point. But we'll talk about that if it comes up. I kind of went over your obstetric providers already, but just know that some of the offices just have doctors, some of the offices have doctors and midwives, and some of the offices have physician assistants, and you would know in advance who you're going to see. These are the numbers for your providers. They will be in the pregnancy planner, but if you need to write them down, you can always write them down at this time. Obviously, if you have an emergency, you'd want to call 911, or you can call the Enloe Medical Center's Labor and Delivery Unit 24/7. There's a nurse there all the time. But for non-emergency issues, you can call the office, or better yet, contact us on MyChart, and we'll get back to you as soon as we can. The next two slides have a lot of helpful resources. I'm not going to go through each one of them. I just want you to take note that they're in there. They're going to be listed in your pregnancy planner. If you have any kind of questions or concerns about being pregnant or about breastfeeding, employment development, or Centers for Disease Control, you can look up really good evidence-based information on these resources and answer a lot of your questions. And this is just another slide that shows some more of the resources that are available. You will be subjected to a lot of lab tests during your pregnancy, so I like to kind of just hit the high spots of those. When you first go in to see your provider at your first visit, they're going to order what's called a prenatal panel. That prenatal panel is going to tell the provider your blood type, if you're anemic or not. You're going to give them a urine sample for sexually transmitted infections. You're going to get the order at your first visit, and then you can go to a lab of your choice to have all of this lab work done. Just so you know that we do have a lab in the Enloe Women's Services North office, which is at 1423 Magnolia. Within that office, there's an actual lab that you can come to anytime. Even if you're not pregnant, you can come there and get your labs done. It's just a nice alternative to going to the hospital. You will also have a glucose tolerance test when you're about midway through your pregnancy or a little bit beyond, around 26, 28 weeks. And that's the test that tests for gestational diabetes. They will collect a urine sample at every visit, and they'll also weigh you at every visit, just so you can be prepared for those things. At the urine that they're checking for at your visit is they're looking for protein to see if you have any protein spilling in your urine. At your first visit, the medical assistant's going to talk to you about genetic testing. I'm not going to go into detail on this presentation, but just know that they'll be asking if that's something you're interested in. They will give you a handout and a pamphlet to read, and then if you're interested, they'll have you sign a consent. So genetic testing will be gone over with you at your first appointment. As far as ultrasounds goes, some doctors will actually do ultrasounds at your first visit. You can always ask them when they call for your appointment. You can always ask if they provide that. If they don't do an ultrasound at your first visit, usually they will order one within the next few weeks so they can check on baby and check on size and dates. And then the last thing on this slide, it says Group B strep. That's just a culture that's going to be taken when you're around 36 weeks gestation. And it's just seeing if you're a carrier of what's called Group Beta strep. Basically, it just means if you show up positive for that, it's no harm to you, no harm to your partner, but the baby can get sick at delivery, so they want to cover you with antibiotics when you're in labor. Again, that doesn't happen till the very end of pregnancy. Probably the most commonly asked question that we get on my chart is what medications are safe to take during pregnancy. When you get your pregnancy planner, you will be given a list of what medications are safe to take during pregnancy, and it's a long list. There's quite a few that are safe, but keep in mind that you want to keep that list around where it's handy during your pregnancy in case you have a cold or allergies or flu-like symptoms or a headache. You're going to want to know what medications are safe for the baby. So keep the list handy. Make sure you're taking your prenatal vitamins starting now. We want to make sure that you are getting those in your system from the moment you know you're pregnant. And I'll go over that a little bit in a minute. Make sure you're not taking any Motrin or ibuprofen products. Those can be harmful to your baby, so you don't do any Motrin during your pregnancy. Always make sure you bring a list of any medications you're taking to your first visit so you can go over those medications with your provider and they can make sure they're safe. And remember that no medication is 100% safe, but you and your provider should discuss the risks and benefits of any medications that you're going to be taking. We'd like to request that you abstain from alcohol, tobacco, and recreational and street drugs during your pregnancy. It's just better for baby, healthier for you as well. If you have any issues or any concerns about these habits, there are resources listed in your pregnancy planner and they're on the screen here. People you can call to help you to quit those habits. Folic acid is probably the most critical nutrient in pregnancy needed in the first trimester. That's why it's important to be on prenatal vitamins from the moment you find out you're pregnant. The prenatal vitamins have folic acid in them, at least they should. So make sure you want to read your bottle and make sure you have 400 micrograms in each little tablet. It's just important to help reduce the risk of your baby being born with a neural tube defect called spina bifida. And if you take your folic acid, it'll lessen that risk. You can also increase folic acid in your diet by increasing green leafy vegetables, berries, bran flakes, broccoli, eggs, oranges, and other citrus fruits. Just eat as much of this as you can when you're newly pregnant, and it will increase your folic acid intake and be better for you and baby. Oral care is very important during pregnancy. Your teeth and gums can be affected by the pregnancy hormones, especially your gums. They can become really fragile and they can bleed often, especially if you're flossing or brushing your teeth. So you want to make sure you continue to take really good care of your teeth and gums and make sure you go to the dentist during your pregnancy at least once. When you do, make sure they know you're pregnant and they can take the proper precautions. A lot of people want to know what a healthy weight and diet consists of when you're pregnancy. When you're pregnant. You want to eat from all the food groups. You want to do your best to kind of graze and not gorge. Lots of small meals. If you're having any problem with morning sickness, then you want to tell your doctor that. We'll go over that in a little bit. But eat what you can, do what you can. Small meals is a good way to help with that. There are some foods you want to avoid, and they are listed in the pregnancy planner. On this slide, you can see a few examples, mostly fish, yellowtail, orange roughy, sea bass, shark. You want to avoid those kinds of fish. It is okay to eat tuna up to 6 ounces a week. Also, you're going to avoid sushi early in pregnancy, throughout your whole pregnancy, and you're going to avoid deli meats. But that's listed in the pregnancy planner. If you start out before you're pregnant at a healthy weight, then we're gonna expect you to gain about 25 to 35 pounds of weight during your pregnancy. If you're on the heavier side before pregnancy, then we'll probably expect you to gain less. And if you're underweight before pregnancy, then we're going to expect that you gain a little bit more than that. But that 25 to 35 pounds is pretty average. As far as health maintenance, what you can do during your pregnancy, caffeine is okay to drink when you're pregnant. We just ask that you limit it and maybe modify your intake a little bit. It's okay to exercise. Whatever you did before is okay to continue to do as long as you're not causing harm or trauma to your abdomen area. And if you didn't do it before, it's sometimes hard to start that kind of exercise during your pregnancy. But if you've always been a runner or a fast walker, it's good to get that kind of exercise in. Excuse me while I take a quick sip of water. Sorry about that. One real important point to emphasize is do not handle your cat's litter box. So you want to make sure that you're avoiding that. If you do have an indoor litter box, let other people take care of that. There's an actual disease that you can get by handling the cat's litter box. It's bad for the baby. So we want you to watch out for that. Try and get 8 hours of sleep at night. You're going to need a lot of rest, especially your first trimester. You're going to be exhausted. And remember that it's okay to get vaccinated when you're pregnant. Flu season is November 1st through April 1st, and we do recommend our pregnant moms get their flu shots during that season, as well as anybody who's going to be around the baby. And when you're 28 weeks pregnant, we will recommend that you get your whooping cough vaccine, which is the Tdap. And also anybody who's going to be around the baby should have a recent Tdap vaccine. There's a lot of symptoms of pregnancy that we want you to know are normal, and they're listed on your screen. They'll be listed in the pregnancy planner. Basically, morning sickness, heartburn, breast tenderness, constipation or gas, darkening and oily skin, stretch marks, varicose veins, hemorrhoids, back pain, fatigue, being short of breath and getting swollen ankles. That happens towards the end of pregnancy. Having to go to the bathroom a lot, that happens early on. And sometimes you'll have different vaginal discharges. This is all normal. You don't need to contact your provider if you're experiencing any of these things. This slide is going to show some of the concerning symptoms. So when you're newly pregnant, if you have severe cramping or bleeding, you'd want to seek medical attention. Also, if you're having continuous or severe vomiting, that would be what I told you about earlier, uncontrollable morning sickness where you can't keep anything down. You want to make sure you contact a medical professional because there are medications they can prescribe that will help you with that. Also, if you have chills or fever, and we consider a fever anything over 100.4. If you had chills or fever in your early pregnancy or throughout your pregnancy, you're going to want to let us know so we can help you find remedies for that. Some of these other concerning symptoms listed here are further in pregnancy. If you had a severe continuous headache, visual changes, if the baby wasn't moving as much as you think they should, those would be all reasons to contact your provider. Preeclampsia is something that happens towards the end of pregnancy. So it's nothing you really need to worry about right now, but we like women to be familiar with the terminology. It's a very serious disease related to high blood pressure during the second half of pregnancy, and it can even come on after delivery up to 6 weeks. The possible risks to a pregnant woman are seizure, stroke, organ damage, and even death. So we want to make sure that you are aware of preeclampsia and what the signs and symptoms are. Signs and symptoms would be stomach pain, swollen hands or face, severe swelling of the legs. You might gain more than 5 pounds in a week, a severe headache that doesn't go away with Tylenol, blurred vision, seeing spots or flashes of light. Those are all signs of preeclampsia. And if you experience any of those, you'd want to make sure you talk to your doctor or get medical assistance right away. Pregnancy can be a very stressful time. So we want to make sure that you're managing your stress well. Eat healthy, exercise, get plenty of sleep, make time to do activities that make you feel good. And keep in mind that if the stress and anxiety becomes too overwhelming, tell your provider. We want to know. You can send us a message on my chart, or you can let us know when you come in for your visit. And we have other resources that I'll go over in a little bit. But we want to help you. We want you to know that you're not alone through this and that we are here for you if you need any help with any of this. One of the maternal, excuse me, one of the maternal screenings we'll be doing during your pregnancy is called the Edinburgh Depression Screening. And it just kind of takes note of how you're doing now. And then we give it to you again at the end of pregnancy and even after the baby's born, just looking out for postpartum depression. So you'll have a sample of the Edinburgh Depression Screening in your pregnancy planner. And you can kind of look at it and see what kind of questions there are and kind of see where you're at right now. Symptoms of anxiety and depression in pregnancy are, there's a lot of them, and some of them are simply symptoms of pregnancy. So you might have low energy or feel tired, change in your eating or sleeping patterns, irritability and moodiness. That can all be part of pregnancy. But if it's coupled with problems concentrating, difficulty making decisions, or thoughts about hurting or killing yourself, then you'd want to make sure you notified your provider so we can get you the proper resources. One of the resources that we offer through Enloe Women's Services is a perinatal and postpartum support group. Unfortunately, right now we're not able to meet, but when we're able to meet, we will get together again. We meet every Friday except for holidays from 1 to 2 at the 1405 Magnolia, which is actually the south building. That slide is incorrect, not the north building. But we meet from 1 to 2 on Fridays, and it's completely confidential. It's completely low key. There's no psychiatrist, no psychologist. It's just women getting together to support each other. There's usually a nurse there and a couple other trained facilitators. And we would love to see people there if they need any assistance or support during their pregnancy or even after they've had the baby. So please feel free to join us on Fridays. You don't even need to make an appointment. You can just come in. Fridays from 1 to 2 once we're able to meet again. The next couple slides kind of talk more about the end of your pregnancy and what to prepare for. And so just sit back and listen. It's certainly nothing you need to know right now, but it might answer some of your questions. One thing you want to know is that Enloe does offer a full range of classes, including childbirth preparation and infant care and lactation support, and all of that. All of those links are available in your pregnancy planner, so you can always look those things up there. When it's time to find a pediatrician, I think the best way is to just kind of ask your friends and family who they use. You can also call the offices of pediatricians and see if they're taking new patients. If you don't have a pediatrician by the time you go into to have your baby, that's okay. Your baby will still be seen by a pediatrician in the hospital, and then you'd have time to find a pediatrician afterwards. And then I told you about the tour of the mother baby unit. It's online at that Enloe website. Enloe's a baby-friendly hospital. It's something you're going to hear us talk about frequently. And you'd think that every hospital is baby-friendly, but this is actually a national designation that we've been awarded because of work that we've done to achieve this designation. Basically, we want you to know that we treat mother and baby as a single unit. So we want mom and baby to be together the whole time they're in the hospital. Um, we're going to encourage exclusive breastfeeding for the first 6 months, which you'll get lots of more information about that. Benefits of breastfeeding include enhancing bonding for mom and helping the baby with their immune system. As soon as the baby's born, that baby's going to go skin to skin with mom, and we'll work on breastfeeding. And then throughout the hospital stay, you'll hear the term skin to skin a lot. We want the baby to be right skin to skin with mom or dad. And then you'll also be rooming in where the baby stays with you. As long as the baby doesn't need to go to a higher level of care, the baby will be with you the whole time you're in the hospital. A couple breastfeeding resources are Better Babies at NVIH, La Leche League, and WIC. And we have all the information you need in your pregnancy planner to contact these agencies. As far as getting ready for the hospital when it's third trimester and it's starting to get time, make sure you have a car seat and make sure you know how to use it. One thing we see often in labor and delivery is dad bringing the car seat in the box the day of discharge. We as nurses actually can't help you assemble it. So it's a good idea to get it out of the box, know how to assemble it, know how to install it, know how to use it, and then bring that with you when it's time to go home. Cord blood banking is something that used to be a lot more popular a few years back, but it is still an option if you're interested in saving the cord blood for the future for either this child or another child. Then we have the, excuse me, we have handouts on how to do that when you get to the hospital, and that's still an option. When it's time to go to the hospital, your provider will go over that information closer to the time. Visitation guidelines right now are changing every day, so I'm not going to go into that, but just know that you'll want to check on that when it's time. Excuse me. As far as infant security, your baby's going to have a wristband and an ankle band that matches your band as well as a support person's band. The numbers are always checked and verified when if the baby for whatever reason was to be taken out of your room, they would be checked and verified when you're brought back in the room. The baby will also have a little tag on their wrist or ankle called a hugs tag. And when the baby goes beyond a certain point on the unit, an alarm goes off. So your baby's going to be very safe with you in your room at Enloe. The number here for insurance and financial considerations is, I just like to make sure you're aware of that. If you want to know how much this is all going to cost you, you can call the Enloe financial counselor, let them know what insurance you have, and they'll be able to kind of give you a rundown. And then the last thing I mentioned here on this slide is just a birth plan. You don't need to have a written birth plan when you come to the hospital, although some people do that. But just if you have it in your mind how you kind of want things to go, and then make sure that you express that to your nurses, and they'll do their best to make sure that happens for you so you get the experience that you want to have. My final slide just kind of goes over a little bit of during and after delivery, just things I want you to know. The birth certificate, that's going to be taken care of when you're at the hospital. They'll do the form for you. You'll fill it out with the name that you choose, and then they'll send it off to the county. And then in about 4 to 6 weeks, you'll be able to get a certified copy of the birth certificate. The Social Security number will also be taken care of. They'll make sure that you get the form filled out for that, and then in 4 to 6 weeks, you'll receive your baby's Social Security card. Circumcision information, if you're having a little boy and you decide to have the baby circumcised, that will be taken care of in the hospital, although some insurances don't cover it if it's in the hospital, so you'll want to find that out before you go. We do a couple different newborn screens on the baby when they're born during their first 24 to 48 hours. One of them is a screening for congenital heart disease. It's very simple. They put a monitor on the baby's wrist and ankle, and they just watch the heart rate and oxygen levels for about 5 minutes just to make sure there's nothing to be concerned with. They also do a blood draw on the baby where they poke the baby's heel, and they do metabolic and genetic testing off those samples. Of course, these are all things you'll need to approve before they're going to do anything. And then they'll do a newborn hearing screen as well, where they actually put little earmuffs on the baby and they check the baby's hearing. Most of these tests will be done right in your room most of the time. You'll also be asked if you want the baby to have vitamin K injection at delivery. They give it when the baby's about an hour old. Also, erythromycin ointment in the eyes is another thing that they do when the baby's about an hour old. And then not listed on the slide, but they'll ask you if you want the baby to have a hepatitis B vaccine. If so, they do it at the same time as the vitamin K shot so that the baby only senses one shot. Keep in mind for safer sleep that it's recommended the baby only sleeps on their back on a firm surface with no toys or blankets. And the last thing I like to say about discharge is if you have everything done on the day of discharge or before the day of discharge, then your discharge is going to go a lot quicker. If you wait to get the birth certificate done and all your paperwork filled out and all the newborn screens done till the day you go home, it'll just prolong the process. That's pretty much all I have for the presentation today. Thank you guys all for listening. And if you have any questions, please feel free to contact us on MyChart. You can put any questions you have through there. If you don't have MyChart yet, please get set up when you get to your first appointment. And congratulations and welcome to Enloe.